Hi, I'm John Tavis. I'm a professor of virology and director of the Drug Discovery Institute at the St. Louis University School of Medicine. Today, I'm here to discuss with you what could a cure for HBV look like. So first off, what is a cure? Well, the research and medical communities are looking for a functional cure. That's when there's no HBV DNA or HBV surface antigen in the blood after treatment ends. This will be great for people with HBV because they'll not need to keep taking their drugs, and their liver health will be very greatly improved. But we don't have a cure yet, and that means that getting a functional cure must be hard. So why is that so? Well, that stems from a key type of HBV DNA that lurks deep within people's liver cells. It's called the cccDNA, and it must be removed or permanently turned off in order to cure HBV. But unfortunately, cccDNA is barely affected by current therapies. Good news is that literally hundreds of different drugs for HBV that work by a very wide range of different mechanisms are being developed by scientists all around the world to try and cure HBV. These fall into two general categories: direct-acting drugs that attack HBV itself. Examples, the approved nucleoside analogs, such as entecavir or tenofovir, work by this mechanism. The second major category is immune-stimulating drugs. They tell the body's immune system to go attack HBV. An example approved drug in this category is pegylated interferon alpha. So HBV is going to be a really hard target. It's going to be a hard virus to cure for all sorts of basic biological reasons. But to make matters even worse, hepatitis B, which is the disease caused by hepatitis B virus, is very variable in different people. For example, E antigen positive patients have much more HBV virus in their bloodstreams than E antigen negative people do. And that obviously affects how you go about designing a cure. Furthermore, HBV comes in many different types. We call them genotypes and subtypes. And those different types can interact with the drugs that we throw against the virus differently. And that obviously affects a therapy. Together, these facts indicate that we must hit HBV in many spots at once to be able to cripple it. It is very unlikely that a single drug will ever be able to be developed that can do that by itself. That's just too hard. That means that we're going to need to use combinations of drugs taken together, and these drugs will need to work by different mechanisms in order to achieve a functional cure. Furthermore, the diversity of the disease and the diversity of the virus makes me think that more than one drug combination will be needed to tailor treatment to patients and virus variants worldwide. This is a tall order. It's going to be hard. However, great advances are being made, and I'm very confident that within the next 5 to 10 years, major advances will be made in developing curative therapies. So, what would this cure look like? This is not clear yet. I think direct-acting and immune-stimulating drugs will be used together. The direct-acting drugs will stop HBV replication. The immune stimulators will eliminate the cccDNA. And I do think that 2 to 4 drugs that work by different mechanisms are going to be needed to be taken together to achieve this goal. Curative therapy is unlikely to be fast, at least for the first generation of the newer drugs. My guess, and it's only a guess, is that it's going to take about 1 year of treatment, followed by monitoring for at least 6 months after the drugs are stopped to make sure that the virus doesn't come back. Finally, the drugs must have low side effects, be simple and be cheap enough to be used worldwide. But as I said before, I'm really optimistic that we'll be able to achieve this and start helping people around the world to cure their HBV infections. Finally, I'd like to point out 3 great organizations where you can go to get more information about HBV and the curative therapies out there, and also to get support for HBV positive people and their loved ones. Thank you very much for listening, and be sure to check out the other ICE-HBV frequently asked questions videos.